A code yellow has been called for the third time in recent records at Albury-Wodonga Hospital after a Sky News investigation revealed senior staff feared they were running the gauntlet and burning out while at work. In a social media post, the hospital announced the update applied overnight, saying it was in response to prolonged and significant demand, and we are urging people not to delay care.
The people who are coming to see us are really very unwell, which means that they need to come into a bed and then they need to stay in that bed for really quite a long time. So it makes it very difficult for us to get the turnover that we need. We're also seeing increasing levels of COVID in our community and COVID in people who are admitted to our health service, and we're now starting to see a lot of other respiratory diseases.
Revelations come as the Victorian, New South Wales and Commonwealth governments wait for the Border Health Service to finalise a master plan for a new hospital. Sky News found deteriorating ambulance response times and heard calls for better infrastructure for the region, which is experiencing growth in population. But when the matter was raised again in State Parliament question time, the Victorian Health Minister blamed the previous federal coalition government.
Will the Minister stop making excuses as to why a new facility hasn't been delivered and finally admit that the border communities deserve a new hospital that can cope with the area's population growth?
Late yesterday, Albury-Wodonga Health put out advice to its staff and its community pointing to the fact that it had to take certain measures to manage demand. They were facing record levels of furloughing as a result of COVID, and that they were also facing a number of bed blocks that were preventing them allowing people to move through the healthcare system. And where did those bed blocks come from, do you think? They came from a former federal government that had starved the National Disability Insurance Scheme.